Hello, everybody, and happy Friday. My name is Maria Arismendi, and I would like to thank you for joining our Conversation Café today, Connected for Care, Building Safe and Healthy Starts. So, this is a very special Conversation Café because it's actually coming from the deep conversations and the deep work that the Building Safe and Healthy Starts collaboration is having. And today is an opportunity to learn more about the collaboration, but also they came from a really humble place to say, Mary, you know what? We really want to understand what other Catalyst members are doing in terms of infant and maternal health. We want to get inspired. We want to learn what's working, what's not working. So today it's not only about talking about the collaboration. Today is also about seeking inspiration, looking for others that might join, and also learning. So thank you for being here. George, I saw you were there. Welcome to the stage.
Thank you so much, Maria. I'm glad to be here. And thank you to all people who have joined in. We're excited to lead this conversation. So the Safe Birth plus Healthy Starts collaboration is a global gathering led by Solar Health Uganda. It's about sharing knowledge, connecting, and discussing the interconnected challenges impacting maternal and infant health within members-owned communities. The collaboration brings together diverse stakeholders to exchange experiences and work collectively towards improving the status quo. This collaboration is open to a global community, that is CBOs, NGOs, researchers, scholars, government leaders, students, and individuals with an interest in maternal and infant health, especially those working in programming, advocacy, research, and those simply curious to learn more. The collaboration's mission is rooted in the belief that no mother or baby should be left behind when it comes to safety, health, and dignity. Central to Solar Health Uganda's work is ensuring reliable energy access, both in off-grid homes and at health centers, because clean and dependable lighting is essential for safe deliveries, timely care, and improved health outcomes. We do this working together with Let There Be Light International. We link clean energy access to broader maternal and infant health priorities, including skilled healthcare, clean water, postpartum services, infant nutrition, supportive education and care, and essential delivery kits, mama kits, that safeguard the health and dignity of both mother and child. The collaboration also seeks to bridge siloed efforts in maternal and infant health by connecting stakeholders who approach the issue from different angles, whether through healthcare delivery, energy, water and sanitation, nutrition, education, or community engagement. Together, we believe we can create a holistic solution that addresses the root causes and strengthen systems of care. The collaboration also Oh, next slide, please. Those are some of the photos of from our projects, how we are engaging with the mothers. That is a photo from one of the project sites called Chibengo Health Center. It's in Lugo district of Uganda.
Thank you, George,
Next.
for walking us through the collaboration. I wanted to ask you if you could tell us a little bit more where this passion started, where this work started, and a little bit more about the story that led you guys, to do this work that's so important in maternal and infant health.
Um, to start with the Solar Health Uganda, the work we are implementing in Uganda, working collaboratively with Let There Be Light in Uganda, Let There Be Light International. It started way back in 2013, and it started at a small scale where off-grid homes were targeted in a broader perspective, whereby not only mothers were considered, but also students, homebound elderly, persons with disabilities, too were considered. So, but in 2019, we launched a project which we call Safe Birth plus Healthy Homes. And that project has been providing portable solar lights to mothers who are delivering at health centers, rural off-grid health centers, at the point of being discharged. A mother goes home with a solar light as an incentive to encourage mothers to deliver from these staffed health centers. In that way, because mainly the problem, which is still very big, even though health centers are available, many of the mothers don't use these facilities and even the health staff there because it has to do with a number of factors, some of which is cultural, and some of which actually is also has to do with the distances. You find that a health center free is located, it serves a whole sub-county, which is a big area uh, that it serves. So mothers have to move longer distances, but also the cultural beliefs tend to also limit mothers from, going to the health centers to, get these services. And instead they go to the traditional birth attendants. So the challenge there, usually when mothers get complications, they can't get the help they need. Also, they miss out on antenatal, on getting antenatal, the medicine that they need, the checkups that they need, they miss out on that. So that's that's why the numbers have been high, and this is a national problem. It's not only a problem associated with one district, but of course through our project we've been getting data from the various districts where we have these sites and comparing which ones are mostly affected, where the challenge is still very big. These facilities, health centers, they have targets. So they have planned to increase the births. And how we come in to, help them achieve these targets. Because still there are so many mothers who are delivering out there in the communities. But our incentives, the solar lights, they are encouraging more and more mothers. I can just give an example of one health center, which is called Kikonda in Changkwans, was one of the first facilities where we take solar lights and they give them to the mothers delivering there. In 2019, they had about 25 deliveries per month, but lately they have between 70 to 80 approximately. So the mothers have increased. The mothers have increased, and which is very good that the facility has been able to reach its targets every single year. It is able to reach the targets. And of course, the target does not stop with the one facility, but also as a district health ministry, they also have targets. Actually, today, we are excited because also we have our colleague, Charity, who works with one of the facility. That is Chukonda, the one I've been speaking about. I think it would be great for Charity to share a little bit about the safe birth plus healthy homes from her perspective as a midwife, because she participates in delivering the babies every single day. I can tell even as of today, maybe she has delivered maybe one or more. Maybe also that would be a good thing to hear from Charity. Yes.
George, that's amazing. Charity, are you there and able to open your microphone?
Hello, good afternoon, everyone. This is Charity, calling from Chikonda Health Center 3. I'm a midwife working with Chikonda Health Center 3, one of the first beneficiaries of Safe Birth Health Home Project. Yeah, like when Safe Birth Health Home Project came to our facility, indeed, we had a need. We didn't have power by that time. Like delivery would be quite hard during the night hours. Sometimes we would deliver mothers using candles, and it was really hard. It was making our work hard, like insecurity. Imagine waking up in the dark, someone has called you to deliver mother. Then when the project came to the facility, they did electrify our facility with the solar lights. So that was a big relief to me as a midwife, whereby I could actually work 24 hours, 7 days. I would be able to help the mothers to deliver. And that has helped us to increase the number of the mothers coming for antenatal and even deliveries and postnatal care at our facility. Actually, before the project began, we used to deliver an average of 30 mothers per month, which was very low according to our targets we have as per sub-county and a district at all. And right now, we have an average of 80 deliveries per month. Then again, like when we deliver these mothers, mostly we live in a place whereby we have a lot of poverty. Most people live on less than $1 per day. Like they live in grass thatched houses, some of them actually they are farmers. We migrate from other places. We migrate from other places in that when they immigrate, they don't have permanent houses to where they are going to practice their farming. So they use big polythene bags to construct houses. Like when these mothers would deliver and they go back, most of the source of the light they would use would be candles, or there is some other local thing. We actually call it tadova, that it emits a lot of smoke when it's lit up, and it endangers the what? The baby's health and the mother's health. That's the mother's health, and that's all they would actually be using after delivery and at home. But when the Safe Birth Health Home Project started donating the solar lights to Chikonda, I think like we frequently hear of like those small houses being burnt by, like there are less cases of the houses being burnt, less cases of babies presenting with pneumonia in early ages. Like it has really improved the lives of these mothers, in that it also attracts them to come and do what? And deliver at the facility. Because those days when they wouldn't get anything, like just coming and deliver, some of them would deliver at home. Imagine they deliver at home, where they've delivered, there isn't, the place is not clean. And so some of them would come back with, would come later on with sepsis. Maybe the mother and the baby are very sick. Some of them would even get PPH cases. And actually would hear some of them would die from the community because they were not well sensitized about the services at the facility. So the more these people are coming, like when a mother comes and they are given a light, it also acts as like they go back home and they mobilize other fellows to come to the facility. So our numbers are greatly increasing. Actually, the project has greatly increased the maternal and child health outcomes at our facility, the number of deliveries, the health of the babies in the community. And actually, they even do businesses with those small lights, like when they
Charity,
like, yes,
that
please.
is that is amazing. Thank you for sharing all that and the amazing work you're doing as a midwife. I see that Sada raised her hand, so I would like to give some room to Sada. And also after, I would also like to introduce a question that Alpha wrote in the chat. Sada?
Yes, thank you. I think this is wonderful. I've been involved with this for since the inception, and one of the questions I had for Charity is I know that you're seeing more births and you're seeing more patients. Is the health center tracking any of the reductions in poor health with the babies, like the pneumonia rates or burn rates, or is most of what you're seeing kind of anecdotal, or the community's talking about it, but 'cause I'm wondering how the district is accounting for maybe improved health, and if they're telling other districts.
Yeah. Thank you, Sarah, for the question. Yes, like the district currently knows that we are having a great number in improvement or in our birth and the mothers attending the maternal and child health services due to this project. Because I've frequently met with the ADHO, who is part of the head of maternal and child health, and he's always commenting on the services which are being given at Chikonda and all the other facilities around Shankwanzi, which are having this Safe Birth Health Home project. And true, the data is also there in the DHS tools as per the district. So they are recording and tracking everything. And actually, they are trying to support us more as the facility, because as like for this financial year, they even promised to add us more midwives so that they can attend to the increasing numbers of the mothers attending these facilities, which are benefiting from the Safe Birth Health Home project. Thank you.
That is amazing. Thank you, Charity, for answering that. Also, I wanted to ask, there's two questions that Alpha wrote in the chat. The first one is what others in Uganda say about this good initiative. So have you received any awards or appreciation letters from authorities in favor of the project? But the other one, first we can start with this one. George, would you like to answer?
Yes, yes, Maria, thank you so much. Yes, this project has received appreciation from district health authorities, the district health ministry in Ruel. They have appreciated and provided us certificates of appreciation to Solar Health Uganda and Let There Be Light International. In Gomba, also part of the work that we've been doing, solar electrifying health centers, also Gomba district in the past has appreciated. Chankwan's district, they've been so much fully engaged with the project, be it the first district where Safe Birth was implemented, and they've always commended our work in whatever way, whether we are maybe writing a grant and we need recommendation letter. They have been very supportive to this day. Yeah.
That is amazing. Thank you, George. And the other one, I think, goes even more into the core of our conversation today, because Alpha was wondering if are there any CSOs or other stakeholders interested in replicating the initiative in other places in Uganda, mostly through your sustainability and replication mechanism. But I think it's the best way to start introducing again what a collaboration is and what is the hope, because Solar Health Uganda is championing this collaboration along with other organizations. But the cool idea and the cool news for everybody, Alpha, included yourself, is that people are able to join the collaboration and join forces and work together. So, George, would you like to share with Alpha and the rest of the audience a little bit on this?
Yes, thank you so much, Maria. The collaboration is open for organizations that are working to improve maternal and infant health in the different ways. So what we are speaking about is clean energy, renewable energy. That is what we are doing specifically. But working with these health centers, we've identified so many other challenges. To speak about like the mama kits, the delivery kits, so many, they are so at these health centers, they don't get enough of these delivery kits. There are issues where we've always been discussing about over, transportation. They don't have ambulances, to fetch an expectant mother who may be undergoing severe, complications or what, to bring them to the health center or to refer them, to to a hospital, for instance, because the hospitals, like for instance, if we're talking about Changwanzi district and Chigoga, they only have one hospital. And so it's not close to these communities or close to the health centers. So there are so many other challenges, even water. If we some of these health centers, they don't have, they don't have actually piped water. They don't have piped water. So the alternative would be harvesting the rainwater, but again, they may not have enough tanks to harvest the water. When we go to, supplies, some of these supplies, they are also not adequate. When we go to, so there are a couple of challenges that the facilities have to deal with. And we believe that through this collaboration, we can continue to discuss that basing on what we are seeing from our communities, from the communities that we serve. And this could be a project, maybe other organizations could replicate in maybe other countries and other regions. But also we are very much interested also in seeing how the other ways to learn about other ways, different people, different organizations are working to improve maternal and infant health. And perhaps actually there could be a way of, connecting, our work. Maybe we are implementing, the Safe Bar, Safe Homes, distributing solar lights, giving solar lights. Maybe there is an organization that is working on mama kits, things like that. And then they could come maybe to Chankwanz, maybe Ruel or Chigoga, and implement, give mama kits to the facilities like that. And that can add a lot of value in a way that we are it makes the collaboration function. So that's like a vision that we have for this collaboration. But primarily, we would want to engage people, organizations that are, are interested, that are passionate, or who want actually to engage into maternal and infant health. And then we can start discussions around what are the challenges? How can we solve this? Such things.
Amazing. Thank you, George. Alpha was just writing in the chat. I recommend you to contact the Inclusive Green Economy Network East Africa to share your work and network with fellows in Uganda and East Africa in general as efforts of expanding the initiative and make others learn. And Alpha, that's exactly the spirit, I think, about the collaboration. It has a strong part on knowledge sharing. Today, we also wanted to do some breakout rooms to learn and get more inspiration from other organizations. So I'm really happy that you can already suggest the Inclusive Green Economy Network in East Africa. And I wanted to ask you if you wanted to share a little bit more with us about the work that Population and Development Initiative is doing in Tanzania.
Yes, Tim. Hello.
Hello, welcome to the stage.
Yes, allow me to go off video without showing the video.
No problem.
Thank you. I'm Alpha Ntayomba. I serve as Executive Director for an organization called Population and Development Initiative. We are based in Kigoma region in Tanzania, and we are a member of Inclusive Green Economy Network East Africa. is the umbrella of CSOs interested in the green economy agenda, and solar energy is part and parcel of these initiatives. And we have a chapter in Tanzania, but the main offices are based in Uganda, as I shared in the chat. In Tanzania, we implement a number of initiatives related with what colleagues are presenting. For example, we have a WASH program. We are addressing water sanitation and hygiene in joining efforts to eradicate or reduce water poverty among affected communities. And actually, our WASH program, we implement it among affected gold mining communities in Geita and among fishing communities. And also we have a health and nutrition program, which we also reach. We work with the agents of change, with the community agents of change, in efforts to make sure that community members live in health conditions from the beginning up to maturity. So inside we have different components like early childhood development, promotion of biofortified crops, and also we encourage solar water filters. We work with the one enterprise, social enterprise in Tanzania known as Solar Lights Tanzania. They have products which are capable of filtering water. So in the context of mining and other challenging contexts, we are promoting these devices in order to eliminate or reduce waterborne diseases among community members, especially children at schools. And in early safe start, we also encourage 100 days from, I think colleagues understand 100 days of mother and baby. We encourage proper nutrition, engagement of male parents to make sure that the babies live in healthier conditions while still in warmth and after birth. So actually we are doing a very similar work, and we are happy to connect and also to encourage each other to proceed with the engaging solar initiatives in the context of health of communities, especially children at a tender age. Thank you very much, team. Yeah.
Thank you, Alpha. And that's amazing. And it gives us the perfect room to share a little bit about the collaboration opportunities, George, that we have. Because in the collaboration, we're welcoming a lot of organizations that are working in this. The idea again is to have like a knowledge sharing. So we are welcoming programming to delivering practical community-based solutions, as you were just mentioning, some research on health system cultural practices and impact evaluation. Also organizations that are doing advocacy for policy, funding, and systemic change that's much needed. And there's also an interest of knowing more about malaria prevention, clean energy, as you were mentioning, clean water sanitation, nutrition, and mental health and gender equity. George, would you like to share a little bit more about this?
Yeah, yes, please.
Go ahead.
Yeah, so we are welcoming members who are engaged in programming directly, offering solutions that improve maternal and infant health. We also welcome researchers. We also welcoming advocates who are advocating for policies for funding and the systematic change. And so it is broad, and And what we are looking for is knowledge sharing. Like for instance, how Alpha has been able to share information about that network. The other thing is the other bigger goal is to see how we can connect in a way of having our projects maybe brought into other communities and maybe another organization projects or services brought into other communities that we know. So in a broader perspective, but knowledge sharing is very important, and also understanding the magnitude of the problem, and that's how researchers can be very helpful in guiding us. For instance, if we talk about the Safe Birth plus the Healthy Homes project, we are doing a lot of data collection at the facilities, but it's very useful that some of this data we can, write some research papers like that from the data, from information that we can gather from the communities, and share these, at maybe international conferences like that. It kind of highlights and it puts our work there for for other people, other organizations to know of what we are doing, to change lives in our communities. So that is very important, and we. And actually, the other group that I've left is also the people who are who have just the interest, to join in, even though they are not working into that area, they are not researching, they are not advocating, but they really want to learn about maternal and infant health. We also are welcoming them.
That's amazing. Thank you, George. And you're talking about the international conferences. There's Alpha Catalyzing Change Week coming really soon, and Powering the Safe and Healthy Starts collaboration is preparing one session. So it would always be welcome if you want to participate in that, and if you want to, of course, refer other professionals that are working on this field, it would be amazing. And now I would like to invite Caroline and Charity. We are ready. That's amazing. Because Sarah was asking, can we hear from Caroline and Charity about the challenges getting this project started in Uganda? And focusing more on what are some lessons that you have learned? Caroline or Charity, would you be able to open your microphones to share a little bit of the challenges and the lessons learned?
All right, thank you. Thank you, Mali. Kauli, and I work with the Solar Health Uganda. And I want to say thank you for everyone for attending today. So some of the challenges that we have faced in the past while getting this project started is one, that is these health centers, like my colleague has said, we target rural off-grid health centers. These are health centers in faraway places. So the distance traveling, going to those health centers, that is one of the challenge we encountered, because we have these roads that are not tarmacked, that go to those health centers, and also they have potholes. So usually some of them are also in areas that are mountainous, the terrain and all that. But so the distance to these health centers. Another challenge is the data collection challenge, because initially we are having a challenge because we are using tablets to collect the data for every mother that comes to deliver this Safe Birth Plus Health Home sites. When they've finished the delivery and they're giving the mother the lights, so there's some data, intake data that we collect, the midwives collect, then they hand over the light to the mother. So a challenge we're facing initially was losing that data, some of the data, because one, sometimes the phone, the tablet was being handled by like 3 midwives. So that brought about some challenges in the data. Some of them also would take the app, the tablet back home. And there's a time someone lost the app on the tablet, so we lost all the data. But what we have done with that nowadays, what we are implementing is we have phones, which phones are kept at the health center. And we have only one person that is handling that. And we have encouraged these data collectors to send the data weekly so that we avoid that. And another challenge is this about internet connection, because these are far away areas. So some of them, the internet connection is really very, very poor. And yet the midwives or the data collectors after is supposed to submit the data to us on a weekly basis. So we have had that challenge of internet connection in some areas. Yes, those are some of the challenges that we have faced.
Thank you for that. And a really good thing now is Jean-Luc is interesting in joining the collaboration. So he represents African 1,000 Days Actions. Thank you. So I will be sharing all the information via email, but for anyone interested, there's always room to join a collaboration through the official channels. That's through the member portal in Catalyst Now. There you will find all the information related to the collaboration. But in this case, since we have you here, Jean-Luc, we will be sharing all the information via email and reaching out to you so you can be invited to the next meeting of the collaboration so you can hear everything that's happening and already start engaging with it. That's amazing. Thank you for that. All right, so are there any other questions, any other comments that you would want to share And the microphone is open for anybody from the collaboration or anybody in the audience that wants to know more.
Hello?
Yes.
Okay, yeah, thank you, thank you. First of all, I apologize. I came late, so almost 30 minutes late, so I missed a lot of the first part of the session. But I'm interested in this collaboration because even though I missed all the part, but the way even it's designed, like supporting children with healthy start and joining forces is something that reflects what we do with the African 1000 Days Action, because we use like an integrated approach where we combine interventions related to health education for pregnant women and also for women who have children less than 2 years. And we combine with the access to clean water, nutrition, and other things. So we combine many things in order to support those families having children less than 2 years. So when I saw this, the collaboration, the theme, the title, so it reflected exactly with what we do. And I think I'm interested to learn more what is being done and what others are doing. And I think for now it's just to hear what the others are sharing, because it will take some time for me to catch up with what happened before.
That's amazing. That's amazing. Gianluca, and thank you for sharing and thank you for making the effort of joining today. So we will be sharing all the recording through email as well. So if you want, again, to go back, review what George, Charity were sharing about the work that they are doing with Solar Health Uganda, you can hear more about that. They also shared at the beginning more on the collaboration and the purpose of the collaboration. And of course, we're always here. I will leave my personal email also in the chat. And give me 1 second. Tara is just saying, African 1000 Days of Action sounds incredible. Partnering and leveraging innovative solutions to improve maternal health outcomes is the way forward. Absolutely in agreement with you, Sarah. Thank you for that comment. Anybody else would like to share anything? If not, what we'll do is after this session, probably next week, we will be sharing all the recording, the slide deck, and also all the information on how to join the collaboration again, just for you to have this information. And if you also want to share this information with another organization that you might think resonates with the work we're trying to do, with all the efforts that everybody is putting into creating this knowledge sharing hub and space and working together and really partnering and leveraging the systemic change, that would be amazing. Super. George, would you like to share some closing remarks or closing ideas?
Thank you so much, Maria. Yeah, before I give my remark, I think I've just read here, Sarah, in the chat, saying perhaps Jean Russi could be also on the panel during the Catalyzing Change Week. Yeah, that would be a great thing. Maybe Jane would want to would maybe react on that. But yeah, I see he says no problem. That's very interesting. So we will reach out via the contacts that you have shared as we plan for that event. Yeah, thank you so much, Jean. So I would like to thank all the participants for committing the time to be here. And it's really sounds so good, you know, for a start, that hearing from, you know, the members about their great work that they are doing. And indeed, we are going to keep, you know, interacting with them. And indeed, because we are going to explore quite a lot that you know, that unites us. And actually hearing about those many great work projects that you are implementing is really great. Hearing, we've just had also an organization, I think Alpha shared about the project they are doing with, you know, solar filters, water filters, like that. Very interesting projects. So there is quite a lot that I believe that we can learn from each other to start with. And of course, going forward, learning about what is there that we don't know. It is very, very good, I think. For instance, when Alpha shared about the other network, we did not know about it, and then we have checked on it. So it feels like the collaboration has started well, and we can only hope for the best. Yeah, thank you so much, Maria, for, you know, organizing and committing time, you know, to help out with this. And thank you to Charity for finding time. I know she has a busy day. She always has a busy days at the health center, but finding time and share, you know, what is happening there and how she's engaging. And she's doing such a great work out there. She represents one of the other you know, midwives, so other many midwives that we are working with, and the VHTs, the village health teams, you know, so many incredible people that we are working with to deliver. But Charity has been such a powerful person, you know, with these many of these projects that we are doing. Yeah, I want to shine a light on every single person who has been present. And we hope that you will always be present in the other, you know, sessions that we are going to have, because we will set up a schedule, and we continue, you know, having even after the catalyzing change week, we hope to continue conversations like this, and it's very interesting. I've loved it being here. Thank you so much, Maria, once again.
Thank you, George, actually, for the work that you're doing. And I think that the words that you just shared with us capture perfectly the spirit of what you're trying to do. It's pretty easy to spot the passion that you put into everything that you do, and everyone that just shared what they're doing, what they are so passionate about this work. I think the collaboration is a perfect place to continue these conversations. There is exciting things coming up, like Catalyzing Change Week, and we would love to welcome all of you into that space. maybe even thinking about how we could co-host the session together. So I'm gonna also follow up on that after. And I really want to thank you again for the amazing work that you're doing. I'm closing this Friday with a lot of inspiration and a lot of, how can I express it? A lot of appreciation for the work that you're doing, even in conditions that are really challenging, but you're putting the best of your talent into working day by day to support communities, especially supporting mothers, supporting infants through their life. So thank you for this. Thank you everybody that joined. My email is always open, and we'll talk soon. So have a great weekend, and thank you all for joining today.
Thank you.
Thank you.
Bye bye.